you think about the shoulder, it's relatively unstable. That's the reason why you have such a great range of motion in there. And so it's commonly dislocated. If you ask them to touch the opposite shoulder, they'll be unable to do that because that joint will be stuck.
Delirium versus dementia. Delirium, the hallmark thing about it is that's acute fluctuating disturbance of consciousness with some disturbance in their cognition, as opposed to dementia, which is just a cognitive decline.
The face, the genitalia, and the intertriginous regions are areas that we really don't like to go somewhere above a low to a mid-potency topical steroid.
Make your incision into that abscess. You need to tie this in place to just take a syringe, and you're basically doing your surgeon's knot. And now you just remove that syringe, and that's your loop drainage.
Irrigation is the key. Now, a couple tricks here. You take a nasal cannula with the little nasal tips, right?
Yeah, right. Just tuck
And
them in
then
there.
you take the tubing and you hook it up to a liter of normal saline,
saline.
or LR,
And
whatever you've got.
You can use a 20 cc or a 12 cc syringe, and you basically inflate it with air until you feel some good pressure on this balloon.
You definitely want to be systematic with any kind of film or any kind of medical imaging that you look at. The first metacarpal is smooth. There's no step-offs in the cortex going along the second.
For the definition of sepsis, you actually don't have to be hypotensive. It takes quite a bit for a kid to become hypotensive because they have such a high sympathetic tone.
As you insert the needle into the skin, that you're going at 90 degrees. Take the suture, wrap it twice around the needle driver, grab that short tail, and pull it across.
The ST elevation is just in 1 and AVL.
If you see a problem in AVL, is your habit to immediately go to 1 and see what's going on there?
Absolutely.
Colds and flus, baby. Talk about bread and butter right here. This is a major reason people seek medical care.